Hello, this is Dr. Zachary McDowell, and I would like to welcome you to Pathoma. Today I would like to talk about rare and unusual diseases encountered on Step 1 of the USMLE board examination. The first disease I would like to talk about is Hanji-Li disease. Hanji-Li disease is characterized by explosive diarrhea. Something board examiners really like to go after is the explosiveness of this diarrhea, which can reach up to 50 feet away from the patient. Patients typically wear Depends, as they've been known to defecate themselves in socially devastating situations. Risk factors include Asian descent, unhealthy affinity for canines, and attraction to Caucasian females. The prognosis for Hanji-Li disease is poor, and the only known treatment is petting a golden retriever 3 times per kilogram. The next disease I would like to talk about is Quinn's quad, also known as Quinn-Wick's disease type 1. Quinn's quad is characterized by anchoparesis, which is the technical term for pooping your pants, micropenis, megacolon, and steatorrhea. Something that board examiners really like to go after is the incredibly small size of the penis in patients afflicted with Quinn's quad. It's unable to be viewed with the human eye and needs magnification. Usually it is visualized with electron microscopy. The prognosis for Quinn's quad is poor and is highly associated with Israel's triad. I've also included this slide for reference. The next disease I would like to talk about is the most devastating of all the rare diseases that I'll cover in this chapter, which is Israel's triad. Israel's triad is characterized by gynecomastia, ambiguous genitalia, and premature ejaculation. Something that's important to know for the purposes of board examination is just how severe the premature ejaculation is in patients with Israel's triad. Case reports have shown that patients ejaculate just by the mere sight of a female. As you can imagine, it's difficult for these patients to have intimate relationships, as they are unable to even touch their significant other without ejaculating. Risk factors for Israel's triad include Romanian descent, online dating, and beating David Asher in basketball. The prognosis for Israel's triad is poor, and there are no known treatments. It's also highly associated with Hanji-Li disease. The next disease I would like to talk about is Cerebronin syndrome. The risk factors for Cerebronin syndrome are eating over 1,000 grams of protein a day, using the word bro in describing your place of residence, such as Chateau Bro, and shopping sales at Brooks Brothers. The next disease is Marfan syndrome. Something board examiners really like to go after is how tall these patients are, as well as being very socially awkward. We also have Tay-Sachs disease, hyper-IgE syndrome, also known as Job syndrome, wet beriberi, Chewbacca disorder, in which these patients are very hairy, Raynaud syndrome, Whitehouse-Friedrichsen syndrome, Stephen-Johnson syndrome, diabetes, and Klinefelter syndrome. Something I would like to emphasize for the purposes of board examination is much like Marfan syndrome, these patients are also very tall and incredibly socially awkward. Many times when these patients make jokes, the people around them will just give the patient a courtesy laugh, as the jokes they tell are just not funny. And last but not least, I would like to cover most awesome class ever. Well, actually this isn't a disease. You'd be fortunate to be afflicted with this condition. I wish you the best of luck, class of 2015. We got this. And this concludes our session of Pathoma for today.